Vitreous humor. Vitreous humor is a colorless gel-like fluid that fills the space between the lens and the retina of the eye. It is acellular and occupies about 80% the volume of the eye. It consists of water, collagen, and hyaluronic acid. The vitreous membrane. Vitreous membrane is a layer of collagen separates the vitreous humor from the rest of the eye. It has the strongest attachment at vitreous base at ora serrata. The other attachments include at the posterior lens, optic nerve head, macula, and also at the retinal blood vessel. Vitreous humor is divided into two, which is the outermost zone and innermost zone. The outermost zone is vitreous cortex. It has tightly packed collagen fibrils. It also slightly adherent to the retinal limiting membrane. For the innermost zone is clockwise channel. It has little collagen, more liquefied, and also transfers by the clockwise canal. The function of vitreous humor include protect the eye, maintain the eye shape, provide structural support to the retina and lens, act as viscoelastic shock absorber, maintain image clarity, stores metabolites for the retina and lens, and also as the gel barrier for diffusion of solutes. Age-related vitreal changes. When we get old, our vitreous humor will change. The cumulative light exposure and oxidation cause an increased cross-linking of collagen peptide chain and hyaluronic acid degradation. Vacuole and gel liquefies will occur. Vitreous degeneration occurs centrally where the collagen concentration is the lowest. Collagen fibrils that are no longer separated by the hyaluronic acid clump and become visible opacities. First attachment of vitreous with optic nerve head will loosen when vitreous detaches completely and become waist ring, which is the floaters. This is some of the disorders related to the vitreous, which is vitreous detachment, vitreous hemorrhage, retinal tear, and also retinal detachment. One of the treatments that can treat these disorders is via virectomy, which is a surgery. This is the fun fact about the vitreous. The vitreous fluid is not regenerated or replenished at any time. Our eyes remain at the same size after about 13 years old.
This topic is about uvea. Uvea is highly vascularized and a pigmented layer of the eyeball. It comprises of the iris, ciliary body, and choroid. First component of the uvea is the iris. Iris is a thin circular structure located anterior to the lens and it divides the eyeball into anterior and posterior chamber. Let's see the zones of the iris. The structure of iris can be divided into two zones by colorate, which is pupillary region and ciliary region. The pupil is a central aperture of the iris, and it also have the iris root. For your information, the average diameter of the iris is 10 to 11 mm. So now, let's explore more about the iris. Iris has ciliary zone, pupillary zone, iris root, anterior epithelium, anterior border, sphincter muscle, stroma, and dilator muscle. Anterior border layer is a thin condensation of the stroma. Iris stroma consists of fibroblasts, melanocyte, blood vessel, and nerve. Consists of sphincter pupillae to constrict the pupil. Anterior iris epithelium is consists of dilated pupillae to dilate the pupil, and the last one, posterior iris epithelium. Pupil is a small aperture of the iris. The functions of the pupil constrict during accommodations, and also it reflects to the light. It prevents build-up of the eye pressure, restrict lights into the eye, and change in different background illumination. Second part of the uvea is ciliary body. The ciliary body is continuous with the iris anteriorly and choroid posteriorly. Ciliary body extends anteriorly to the scleral spur, where it is firmly attached to the sclera, and it extends posteriorly but demarcated by ora serrata. This is the part of the eye. Pars placata, also known as ciliary process, which extend into the posterior chamber. Pars plana, the flatter region that extends to the ora serrata. Ciliary stroma, that consists of highly vascularized and loose conductive tissue. Ciliary epithelium, that consists of two layers, pigmented and non-pigmented. Ciliary muscle, which are circular muscle, longitudinal muscle, and radial muscle. Function of the ciliary body: produce aqueous humor involved in accommodation. Aqueous humor is a clear plasma that forms through diffusion, ultrafiltration, and active secretion. Function of aqueous fluid is deliver oxygen and nutrients, provision of low refractive index, and maintain the intraocular pressure. The composition of aqueous fluid. Aqueous fluid has mineral that actively transport to the cornea and lens, high in lactate due to anaerobic glycolysis, maintained by blood aqueous barrier, and involve active and passive exchange. Aqueous drainage. Once aqueous fluid secreted into the posterior chamber, the aqueous will pass through the pupil into the anterior chamber for exit. Aqueous humor exits the eye via two pathways through trabecular meshwork road and uveoscleral road.
Hi everyone, today I'm gonna talk about choroid. The red color in the eyes is indicated the choroid. Let me tell you some info about choroid. Choroid has highly vascularized layer. It is also main vascular supply to outer retina. Thicker around posterior pole than anteriorly, attachment is firmest at the posterior pole and contains 4 layers. There are lamina fusca, stroma, choriocapillaris, and basal lamina. Now let's go to lamina fusca. It is lies adjacent to the sclera. It has 10 to 30 micron thick, and it composed of collagen bands and fibroblasts and melanocytes. It is also transverse suprachoroidal space. Next is stroma. Stroma is pigmented, composed of loose collagenous tissue, melanocyte with some elastic fibers, and contains many blood vessels. The large vessels derive from 2 sources. Next layer is choriocapillaris. It consists of white bow capillaries and provides nourishment to the outer retina, and it is only within choroid that does not continue into the ciliary body. And lastly is basal lamina. Basal lamina is a compound basement membrane between the pigment epithelium of the retina and the endothelium of the choriocapillaris, innermost layer of choroid, and runs from optic nerve to the ora serrata. These are the main function of the choroid. That's all. Thank